Thank you so much for having me.
We were talking about, it's called Rezūm, R-E-Z-U-M.
Very good, yes.
How does it work, Doc?
So it's a water vapor therapy where we inject little tiny balls of steam into the prostate through the urethra.
Okay.
And what that's going to do is destroy the cells just up to the prostate capsule. So all of that tissue that's been pushing on the urethra and causing all those obstructive symptoms will now disintegrate, your body will reabsorb it, and the urethra will be open.
How long does it take the body to reabsorb?
Sometimes people start noticing symptoms symptoms starting to go away as soon as 2 weeks after the procedure, but sometimes it can take up to 3 months.
And I do want to point out, this is not a procedure if they find cancer cells.
Right.
This is what is it called, BPH?
Yes, benign prostatic hyperplasia is
Right.
basically enlargement of the prostate. So the prostate pushes on the urethra and causes obstruction. Obstruction can manifest as having to go to the bathroom but not being able to go right when you get there. We call that urinary hesitancy. It might also be that you have to go frequently to the bathroom or rush to the bathroom. A lot of men complain of a weak stream or having to get up a lot at nighttime. But yeah, this affects over 50% of men over 40. So a lot of men are walking around with these symptoms, just kind of brushing them off or taking medications for it. Unfortunately, the medications sometimes have side effects that are unpleasant, such as sexual side effects, dizziness when you stand up.
What about this procedure, Rezūm?
This procedure, most of my patients are coming off of their medications after we do the procedure.
And it's similar to, you put a little needle, it's like a biopsy almost? And
Kind of. We put a scope in through the urethra, and then through that scope is where we use the machine. And we pop a little tiny needle into the side of the urethra where the prostate is. It's a 9-second vapor ball.
Are you awake? Is it, you just
You're
use
awake
a local?
in the office.
Okay.
It's under local. We can also give you a light sedation with like a pill or something.
Yeah, if it kind of gives you the willies thinking
Exactly.
about it. Yeah.
Most of the guys do well without it. We can also do a local prostate block, so hopefully you don't feel it very much. Most of the men who don't have anything, you know, they take a deep breath and it's over pretty quickly. It's only 9 seconds for each treatment, and most men require about 2 on each side, maybe 3 on each side. So the whole procedure lasts about 2 to 3 minutes, depending on how many treatments you get.
And I looked at it, looks like Medicare picks it up. Private insurance may require prior authorization, but
Right.
as far as the success rate, it looks pretty good.
It does, and out of pocket, I mean, at SLUCare, we're charging about $3,200 out of pocket, which compared to these other prostate
That's lower.
procedures is very cheap, because you can come into the office that day, the whole visit's about an hour, you can drive yourself home, you can resume normal activity in about 3 or 4 days, and usually we see those symptoms improve over the next 1 to 3 months.
And quality of life improves. Well, thank you,
Yes.
doctor. We appreciate it. If you want to get more information, we do have a link. It is at Fox 2, the mobile app. It's also at SLUCare.